It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that help change people's lives.
Exactly right, Candace. Like our first doctor, spine surgeon, Dr. Robert Myles, who has some great information for those suffering from chronic back pain.
Roger is a patient that came in immediately before Christmas. He was a gentleman in his 60s who was attempting to go to the bathroom and passed out on the floor. And when he awoke, he was paralyzed from his neck down.
As it first happened, I was in and out of consciousness, but I was really frightened when first of all, I couldn't move my legs or my arms.
Unfortunately, when he passed out and fell onto the hard surface of the bathroom floor like a rag doll, he didn't have any support from any of his normal muscles because he was unconscious and allowed all of that really significant arthritis to really hurt the spinal cord.
It was the very first time that I met Dr. Stachniak. I had never had an occasion to use a neurosurgeon. I was totally impressed with how she came across as being very confident. Also, I mentioned earlier her bedside manners, the way she just held my hand and gave me that feeling that it wasn't just going to be a business deal, but it was going to be personal.
We had to reconstruct his spine from the front and the back to take away really severe degenerative stenosis that he had developed over the years that was totally unbeknownst to him. It was a very complicated surgery that was about 5.5 hours. And after surgery, we had felt that everything went perfectly, but unfortunately he could only have some flicker movements in his extremities.
And I think one of the things that I wanted to happen was I just wanted to be well fast.
And it wasn't until a couple of months after surgery that he really started to see big improvements in terms of his strength and actually starting to gain the function to be able to walk. And then as months started to progress after that, many really significant kinds of improvements started to happen fairly quickly.
And then finally you get that courage, you get that feeling in you that that you can beat this thing, that it can happen.
Bonnie has a beautiful baby girl, and she credits obstetrician Patrick Allen for possibly saving her life. To find out more on Bonnie's story and other life-changing stories, log on to bestdocsnetwork.com.
I just had gotten to where I was feeling run down all the time. I was feeling like my quality of life was slowly starting to deteriorate. I was starting to have some other medical problems, and it was just one thing after another, and I just felt like, I had too many more years to live, and I didn't want to live having to deal with those kind of problems.
Ms. Cohn was about 40. She had a BMI of 41. She had been overweight most of her life. She didn't have a lot of medical problems, but she did have migraine headaches, and we talked about the options of what we could do, and she decided that she would like to have the sleeve.
I liked the fact that in removing the portion of the stomach that it does during the sleeve procedure, it also removes some of the hormones that triggers your hunger and your appetite, and I thought that that might have some impact on the migraines that I was having. With the hormonal changes and all of that might be related. So that's really why I decided to go with the sleeve.
She now has a pretty normal BMI, and she's keeping her weight off. She lost her weight over a year to 2 years, and she's doing really well. Interestingly enough, she no longer has migraine headaches.
As part of my lifestyle change, obviously you make eating habit changes, but I also joined the gym to really change my physical activity level. January, before I had my surgery, I had done a 1 mile fun run walk. The sad part looking back at it is that I couldn't even finish the 1 mile. Then a year later, I kind of vowed that I was going to do the 5K in that same race, just kind of to prove to myself where I had been and where I had gotten to and what I had achieved. I ran the 5K and I actually placed 3rd in my age group, which was a total shock to me. That really was a wonderful feeling. I had taken advantage of this second chance that I got to change my life.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
The Best Docs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
Growing up, horses were a big part of my life. I rode every day, several horses a day, and competed through high school. The main problem I was having in my low back was that the discs were degenerating, and I was told it was common in 60-year-olds, not in 30-year-olds. I had some tears that were leaking fluid and was having pain and discomfort down my legs that was keeping it where I couldn't sleep and was just in chronic pain. Did therapy for my back but still had issues. Slowly things started to go, like riding the bicycles or certain chores around the house.
I generally tell people that surgery is the last thing that we want to do. If the pain is so severe that it starts to interfere with your life, your hobby, your friends, your work, then it might be something that you should consider. If you're in that situation where you have to come home and spend your life dealing with the pain, then surgery is probably something that's a consideration if you failed all the other conservative treatments.
Being that I live in Kansas City, I was from the Dallas-Fort Worth area. I had seen a few doctors in Kansas City and not really gotten any definitive way to get relief. After seeing the Best Docs episodes and watching Dr. Myles, I decided that he would be a good person to contact, and he was willing to look at my information and tell me if he saw anything. And he did see several things that my doctor in Kansas City did not see.
Generally with the surgery process, our goal is to decrease your pain, and our main goal is to get rid of your pain. So that's what we're trying to do when we offer you the surgery, is to get you back to living your life the way you were beforehand with pain freedom.
When I heard other patients talk about achieving pain freedom and that was Dr. Myles' goal, it sounded like a nice idea, but I didn't really think it was possible for me. It's been 3 months since the procedure, and I feel better than I can remember feeling. I thought I would be able to return to riding in January, but now he has told me I can move that up to next month. I'm very excited what he's been able to give me and really have given me what he promised, which was pain freedom.
We have an epidemic of diabetes going on in America at this time. Diabetes is high blood sugar. Normally, your blood sugar should be less than 100. We define diabetes as a blood sugar of 126 or higher. If you have a blood sugar of 100 to 125, that's called pre-diabetes. If you don't do something about it at that point, it will develop into diabetes almost for sure. What's bad about having diabetes? Well, it damages every blood vessel in your body. That can result in vision problems, even blindness. It can cause kidney failure and heart attacks or strokes. None of those are good things. To prevent or treat diabetes, the best thing you can do is lose weight. That will help the most. Also, eating an ADA, that's an American Diabetes Association diet, will help. You can find that on the internet at multiple websites. So if you have high blood sugar, exercise, eat right, and things should get better. Remember, sugar is sweet, but you don't want to be too sweet.
Cindy had trouble losing weight until she met Dr. Kim. To find out more about Cindy's story and other life-changing stories, log on to bestdocsnetwork.com.
I was one of those people that felt you always had to make work the next day. So in February, when it was icing over and everybody was thinking they were ready to stay in for the night, I was out spreading the ice melting salt on the driveway. And there's a ramp in the back of my driveway, which is about a 30-degree slope. As soon as I hit that ramp, I went down and landed on the back of my head.
In Mr. Neiman's case, it was really more of a combination of a traumatic brain injury with a very severe concussion. We immediately got him in with a neurosurgeon who wanted to make sure that he was a candidate for evacuation of the blood, with the full understanding that this still wasn't going to make him whole again.
At that time, we went through some of what was going on in the test, but I was kind of getting in and out of the picture. That day, I thought he was through with our interview, so I was getting up to leave. He walked up to me and grabbed me by the arms and he said, "You're not leaving. You're not leaving till I get you checked in the hospital." And I said, "Well, I've got another neurologist appointment on the 28th. And he said, "You will be dead."
We were able to arrange for him to have a monitoring EEG done at his home. So we can watch him sleep, we can watch him interact, and we can actually see what these symptoms were that were kind of coming and going. And it turns out that he was having significant numbers of seizures.
After the third week, and I was just really having a lot of difficulties, they took me to the hospital, and we discovered I had a subdural hematoma.
90% of treatment is recognition, and then the other 10%, even though it's a very hard 10% to achieve, is finding the correct treatment modality for the correct diagnosis. There are a lot of hallmarks to concussion. Once you can recognize it, you can treat it correctly, and I would say the younger the patient and the quicker that we can get to them, the better the outcome.
If it had not been for someone with as much knowledge of what was going on, he saw it in my eyes, he saw it, and he took the time to take care of it. I don't know what I would have done without.
Vicki had sinus pressure with pain every day until she met Dr. Joshua James. To find out more about Vicki's story and other life-changing stories, log on to bestdocsnetwork.com.
Genityte is a treatment for stress urinary incontinence, urgency incontinence, urinary urgency frequency issues, as well as rectal incontinence and rectal tone issues.
As a healthcare professional myself, I was actually researching procedures that were non-surgical that could maybe help alleviate some of the urinary symptoms. And then that's when I found out about Genityte and Dr. Carol Norton at Finer Touch.
This is a procedure that has been performed for about 4 years now. As of yet, there are only 4 physicians in the country offering this procedure.
She gave me truthful answers, and whether or not I was a candidate, and let me know that this is what the procedure may do, but at never any point in time was it that I made it feel like it was just going to be the end all or the do all. I was given very realistic expectations.
It's a non-surgical approach that has the same efficacy, if not better, for certain problems as the surgical approaches do.
For the first day, we were already starting the procedure. It was about an hour, and during the procedure, Dr. Norton is explaining everything that she's doing, so you're very comfortable.
Basically incorporates the use of an infrared technology to help tighten the tissue of the vulva and vaginal area in a way that's very natural to it.
I'm only in my early 40s, so having even occasional urinary leakage was not something that was appealing at all. But now I'm probably 80 to 85% of my symptoms are improved, and for me, that is wonderful.
Those are the stories we hear over and over again with this, is patients who have basically given up finding any relief for the problem. Then they come and see us, they have a treatment done, and it restores their function back to normal, essentially.
I would highly recommend Dr. Norton and the Genityte procedure to anyone who is having urinary leakage or incontinence, if you do not want a surgical intervention, because for me, non-surgical was the way I wanted. If that's what you're looking for, I would highly recommend Dr. Norton and Genityte.
Don't forget, for more information on any of the great doctors you see on today's show, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
That's right, and now it's time to head to our next doctor, ear, nose, and throat physician, Dr. Joshua James, who has a unique way of helping those that suffer from chronic loss of voice.
We hear when you're a kid in school and all talking about having good hygiene and keeping your body clean and this sort of thing. It is very important. Most people don't realize that there are a lot of very dangerous microorganisms out there. There are things like staph, there are viruses, or all sorts of things. We hear stuff in the news about the avian flu and all these sort of things. And if you don't use good hygiene, you don't keep your hands clean, if you take your hands, touch your nose, your eyes, your mouth, those are ways that you can transmit diseases to your body. And there are some organisms out there that just by being in certain situations you can be exposed to, like this very dangerous methicillin-resistant Staph aureus, the MRSA that a lot of people have heard of. That can really be a very dangerous bacterium. And we're finding more and more of these cases are acquired in the community. Years ago they were only in the hospital, but now we see a lot of people just getting them just in general. So there are a lot of things like that that can cause problems that people don't understand where you can actually acquire one of these infections. For that reason, it's very important that people do keep their skin clean, that they do wash their hands relatively frequently or use one of the hand cleansers, and especially if they are a carrier of something like staph, to use some kind of measure to keep their body from developing a boil or one of these more dangerous infections. And so as a consequence, after you've been in that environment, you really ought to use some kind of a measure to sort of sterilize your skin, so to speak, and make sure that you take either a shower or wash your hands or something at the very least to make sure that you're not going to actually be colonized with one of these organisms that can lead to a more serious problem. One of the ways that we're kind of excited about is that we've developed this new bleach-containing wash. Bleach is very strong antiseptic product. It actually kills just about any bacterium. Kills a lot of other things like viruses and even fungi. And if you use something like this, it will cleanse your body quite well. And if you use it on a periodic basis, you can maintain your body from actually getting colonized and keep it sterile or keep it cleaner for a longer period of time. So we recommend using something like that or one of the antibacterial soaps or something to keep your skin from getting one of these serious infections.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
Tennis elbow is a very common condition. The real medical term for it is lateral epicondylitis, which is a fancy name for pain on the outside of your elbow. But tennis elbow is a form of tendinitis, usually from repetitive use. What's peculiar is that 95% of the cases usually have nothing to do with tennis or any other racket sports. It's just everyday people doing repetitive things and they get the tendinitis in their elbow. Tennis elbow can present as both a sharp pain and a chronic pain. It usually gets very sharp when they try to lift something heavy. And they'll feel that sharp pain in the elbow, which can radiate into the forearm as well. But once you get it, it can sometimes be very difficult to treat. It usually lasts for months. We try to treat it conservatively initially. We do that with special elbow straps, and a lot of times you'll see people running around with these straps around their forearms. Some are just soft straps you wrap around your forearm. Some have plastic pieces and rubber pads in them. Some have little air pockets in them. All of them serve to put a little compression on the muscle and take a little bit of tension off the tendon to try and give it a chance to heal. We also try to treat it with steroid injections and anti-inflammatories, and sometimes with therapy and special stretching exercises. And we'll try to do that for several months. And most of the time that works. Every once in a while it doesn't work, and then we have to talk about the surgery to fix it. Now in the case of tennis elbow, the problem is that sometimes you get a lot of little micro tears in the tendon that just don't heal. And in order to address that surgically, we make a small incision in the elbow and we release the tendon, clean out the inflammatory tissue, and then anchor the tendon back down to the bone so that it heals as a nice solid anchor for the muscles that it's attached to. And then once you get a nice solid anchor, the pain and inflammation go away and you achieve pain freedom. After surgery, the patients are in a splint for 1 to 2 weeks, and then we start some gentle range of motion therapy. We don't really let them do any heavy lifting until 6 to 8 weeks after surgery. But once they get through the rehabilitation process, they're able to return to normal activity with significant improvement in their symptoms.
The Best Docs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
A bunion is a bony deformity, a structural bony deformity that is painful with wearing any type of enclosed shoes. It's an inherited thing. Mom, Dad, Grandma, and Grandpa give that to you.
I had one of them surgically removed about 9 years ago. It was a very unpleasant experience, long. The healing time was probably prolonged because of the treatment. So I put off getting my feet fixed.
The mechanics that cause the bunion quite often are associated with the same thing that causes the hammer toes. And there's different degrees of hammer toes. Jeannie came to see me complaining of severe pain. She had had bunion surgery a number of years in the past in a different state. And because of her experience there, she was very reluctant to have this current bunion looked at and taken care of.
My mom and I started looking and researching, and I just decided to pick Dr. Singleton. Liked his personality. He was very clear and concise about the surgery.
Bunion surgery usually involves the cutting of the bone and shifting the cut fragments over to realign the joint, to take the compression forces out of the inside of the joint. If you just take the bump off, that's where bunion surgery has in the past, I think, got a bad reputation. By just taking the bump off, you've done nothing to correct the mechanics that's causing the bump to develop in the first place.
The right foot's healed up really good. The left foot is well on the mend. I can wear my tennis shoes today. My mother and I just, I hit the ground running, and I mean to tell you, as soon as I could get up and walk around, I did.
It's really relatively soon after surgery for her to be doing as well as she's doing right now. She's been a fabulous patient. She's done everything we've told her to do, and that helps so much in a person's recovery after surgery.
So I achieved my goal through this surgery and coming to Dr. Singleton and the surgery that he performed, and I am enjoying pain freedom with my feet, able to do more.
David lost over 100 pounds, and he credits Dr. Carol Norton in helping him lose the weight in a non-surgical way. To find out more about David's story and other life-changing stories, log on to bestdocsnetwork.com.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Vaginal rejuvenation is a procedure we do for women who come to me and they say, I just don't feel like I was when I was younger. It's just not the same after I had that baby. Well, what happens during childbirth, particularly a vaginal childbirth, the vagina gets stretched, the muscles loosen up, the vaginal walls stretch, And the result of that is that women feel loose. There's vaginal looseness, so they don't have those sexual pleasures like they had before they had the baby. We need to recreate those and bring them back to the state that they were before she had babies. The process is done here in the office. It is done while the patient is awake. We use sedation, mild sedation, and a local anesthetic. We tighten the muscles back together again. We recreate the vaginal condition such that it is tighter with intercourse and it feels better. The frictional forces are able to be created so that the patient gets better sexual pleasure. After vaginal rejuvenation surgery, patients are able to go back to work within 1 or 2 weeks. They're pretty sore down there, but we give them a prescription for special suppositories will help to reduce the spasms that they have and some of the soreness that they have. After vaginal rejuvenation, we've had a lot of people come back and they say it's great, intercourse is wonderful, they are now feeling. Most women, right after the procedure, a few days after, can go back to work. Some people can go back to driving within a week or 2. But it's a rapid recovery. It's a procedure that is very low downtime and has great results. If the patient comes in talking about my labia are too long, they're extending below my labia majora, when I stand up I see tissue falling down in between my legs, I don't like this, it's uncomfortable with intercourse, and we can treat that with a labiaplasty. A lot of women, they have some poor self-esteem because of the way they look down there. By doing a labiaplasty, it helps boost up their self-esteem. They feel better about themselves because they look better down there too. We have options for people to help them to look better, to feel better about themselves, to help them to improve their sexual life, to improve their quality of life.
I started having symptoms of endometriosis that we didn't know at the time was endometriosis in my very early teens, and hospitalized a couple of times. It wasn't until I was 18 that finally it was diagnosed as endometriosis.
The glands which are inside the uterus, if they are anywhere else besides inside the uterus, that's considered endometriosis.
I was a little bit trepidatious whenever I first came to Dr. Allen because I wasn't sure what to expect and how it was going to be. And from that very first visit, he just made me feel like I was in the right hands, that he was going to take care of me, that he was up on all the research for endometriosis, and that it was going to be okay, and that hysterectomy was not the answer for me, that there was hope for me to be able to have children.
Usually if a woman starts having some of the symptoms of pelvic pain, painful cycles, painful intercourse, we'll try more conservative treatment. Sometimes you put patients on oral contraceptives and it seems to keep their symptoms under control and you don't work it up anymore.
It basically puts your body through a chemically induced menopause, and the theory being that if your body isn't having a cycle, the lining of the endometriosis won't be able to be on the outside, so it won't be able to be growing as quickly.
There's really 2 ways to treat it. You can either try to excise it, do surgery, ablate it, and the other way is if you do not want to do surgery, you can do one of the medicines to reduce the amount of estrogen. I use Lupron, but there's a couple of other products on the market as well.
I have Zachary now. He's a 5-year-old, started kindergarten this year. But even beyond that, I haven't had surgery in over 5 years unless you count my C-section. From the time I was a teenager until that moment had been so that I could hold that baby, and Dr. Allen made it possible.
If they get good pain relief from surgery, sometimes they want to get pregnant. I tell them go for it. Pregnancy is a great thing for it as well. A lot of times if a patient has a baby, it seems to make a huge difference in how it comes back. It doesn't come back for a long time.
All right, that'll do it. That'll wrap up another edition of the Best Docs Network that features, of course, some of the best doctors in the Dallas-Fort Worth area that help change people's lives.
That's right, and for more information on any of the fine doctors that you've seen on today's show, just head to our website, bestdocsnetwork.com.
And if you have a question or comment for us, or is there a doctor that has helped change your life, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
That's right. So long, everyone. We'll see you next week.